Many things to coordinate. All right. Well, thank you everyone for coming to join us today. Welcome to our first education session of the fall. I wanted to introduce myself. My name is Allie Grady, and I'm an education coordinator here with the Alzheimer's Society of Peterborough, Kawartha Lakes, Northumberland, and Haliburton. And joining me to present today is Chris Van Leuven, who is also an education coordinator with us. Just a couple of housekeeping things. If you wouldn't mind just keeping yourself muted while we are presenting. And then at the end, we can take time for questions if you'd like to unmute yourself. If you do have any questions, you can put them in the chat. We are gonna just wait until the end to address them, if that's all right with you. And that way, sometimes when we're sharing the screen, we can't see all the questions in the chat pod. So this helps us if we do them at the end, but we will get to your questions. So thank you for that. All right, so today we're talking about the different types of dementia. And this is kind of an overview of them. We're not going really in depth into any in an extreme depth, but enough that you can understand that there's a few different types and that there's different symptoms and causes of each. So a little bit of an agenda. We're going to start off with what is dementia, just in general terms. Then we're going to talk about the reversible causes of dementia, because there are some dementias that are caused by things that can be reversed. We're going to look at the irreversible causes of dementia, including 4 of the most common. So Alzheimer's disease, vascular dementia, Lewy body dementia, and frontotemporal dementia. And then, as I mentioned, we're going to have some time for conclusions and questions at the end. So what is dementia? Well, dementia is a set of symptoms, which includes loss of memory, understanding, and judgment. It happens when someone has some kind of disease or disorder in their brain. And the symptoms can vary depending on what the cause is and the part of the brain that is affected. One of the most common questions we get asked is, what is the difference between Alzheimer's disease and dementia? So while dementia is kind of this umbrella term, Alzheimer's disease is just one specific cause of dementia. So we have a cute little video to help explain this for you, and Chris is going to share it, and then we'll go a little bit more into it afterwards. So make sure you can have your volume up, and here we are.
What's the difference between Alzheimer's disease and dementia? Perhaps you've been confused by these terms in the past, or mistakenly thought they were the same thing. Well, you wouldn't be alone, because knowing the difference between Alzheimer's disease and dementia can be tricky. But it's actually not too hard to understand. In a nutshell, it's like the difference between shortness of breath and asthma. Shortness of breath is not a specific disease. It can have many different causes, and asthma is just one of them. Likewise, dementia is not one specific disease. It's a combination of symptoms that has many different causes, including Alzheimer's disease. Still sound a bit confusing? Okay, think of it like this. You go to your doctor with shortness of breath. To find the cause, she listens to your chest to see if it's due to asthma or pneumonia. And then she checks your heart to see if your breathlessness is caused by heart failure or a very rapid heartbeat. She even asks if you've been worried in case your breathing difficulty is anxiety related. After her examinations, she concludes that your shortness of breath is actually a nut allergy. Similarly, when dealing with dementia, your doctor needs to figure out the underlying cause. And while Alzheimer's disease is the most common cause of dementia, it's not the only one. Dementia can also be caused by vascular changes in the brain, Parkinson's disease, Lewy body disease, vitamin deficiencies, thyroid gland problems, chronic brain infections, or medications. Even a very deep depression can sometimes look like dementia. Which means if someone you love has dementia, it doesn't necessarily mean that they have Alzheimer's disease. And that's very important for your doctor to establish. Because some causes of dementia, such as infection, medication reactions, an underactive thyroid gland, or vitamin deficiencies, can be reversible with the right treatment. So figuring out the cause and a plan of action could improve your quality of life. And that's why, if you or your loved one have the symptoms of dementia, you need to see your doctor to find out the underlying cause.
All right, let's talk about this a little bit more. So in this image on the slide, you can see an umbrella, and the umbrella is dementia. It's this overarching concept, and the two boxes on either side show some of the common causes of dementia. On the left side of the umbrella, you can see the reversible causes, and those are listed as medication side effects, nutritional deficiencies, metabolic disorders, depression or delirium, and sleep disorders. We'll talk a little bit more about those in the next slides. On the other side, you'll see that we have the irreversible causes, and this may be things like Alzheimer's disease, Lewy body dementia, vascular dementia, frontotemporal dementia, or a mixed dementia. This is important because often when we hear the term dementia, we automatically jump to the irreversible causes. It's important to consider the second half of the umbrella and understand that there are some that we can reverse. This is another image of the umbrella. It can be a little bit harder to see. The font's a little bit smaller, but the same idea. On the left side with the blue font, we have the reversible causes of dementia, and on the right, we've got the irreversible causes. You may be surprised to see that there are so many different causes of dementia, but if you can believe it, there are even more types that are not listed on this umbrella. Some researchers think there are over 100 different causes and types of dementia that exist. We're not going to talk about them all. We don't have time for that today, but we are going to talk about some of the most common types in better detail, so you have a better understanding of the condition and some of their key features and characteristics. Okay, so let's go a little bit deeper. The types of reversible dementia. What do we mean by reversible? Well, in these cases of dementia, it is possible to improve on symptoms, so improve memory, maybe even return to full cognitive functioning if they are treated, if the condition is treated. So this includes something like depression. Sometimes the symptoms of dementia, like withdrawal, inability to initiate activity, and memory loss can be due to an underlying depression. Depression is highly treatable, and with therapy, medication, and lifestyle changes, the symptoms may reverse. Medications. There are certain medications, such as sedatives, which can cause some of the symptoms of dementia as well. Some medications can also interact with each other to cause symptoms of dementia, including prescription medications or combining them with over-the-counter medications or supplements or natural remedies. A doctor or pharmacist can help evaluate.
She has to be there.
Oh, I wonder if, did you have a question or do you just want to mute yourself there? I think we're all good now. I was just saying that if you are wondering about dementia and you do take several kinds of medication, it might be worth talking to a doctor or a pharmacist to evaluate if there might be an interaction going on. Nutritional disorders, vitamin deficiencies, even dehydration over a period of time can cause symptoms of dementia, particularly in older adults. And again, with better nutrition, supplementation and increasing fluid intake, you can actually reverse some of those symptoms of dementia. There's also metabolic disorders that could be causing symptoms, so like a thyroid disorder. And if you can detect those things, if you can detect the thyroid deficiency, it's easily addressed through medication and monitoring. We also have other conditions on here. So what are those? Well, it might be something like an infection, something like a urinary tract infection or a UTI, even pneumonia, a tumor, a brain tumor, even severe constipation. All of these things can possibly cause the symptoms of dementia. And if they're caught and treated, then the symptoms can be reversed. Then we have the irreversible types of dementia. So what do we mean by irreversible? Well, we mean a progressive, degenerative, and typically fatal disease that gets worse over time, and that the brain damage from these types of dementia cannot be fixed or reversed. So progressive disorders that we're talking about here, we're talking about Alzheimer's disease, we're talking about Lewy body dementia, maybe Pick's disease, where these symptoms continue to get worse over time. And at the present time, there's no cure for these, so the brain continues to atrophy or degenerate over time. Another type of irreversible dementia is vascular dementia. We will go into more detail about this later on, but it's often due to a stroke. Subcortical dementia is a small vessel disease. It has to do with those small blood vessels in the deeper areas of the brain. And we'll talk a little bit about this one later on as well. But there's other types of subcortical dementia, and these include Parkinson's disease and Huntington's disease. And those ones, though they primarily affect motor functioning, they can also affect cognitive functionings as well. Head trauma. This is an area that we haven't touched on yet, but head trauma, especially trauma that leads to a loss of consciousness. So you think of maybe a boxing match where somebody loses consciousness, can cause brain damage, and it can get worse over time. It can be progressive as well. There's no evidence that just one single mild traumatic brain injury can cause dementia or increase that risk, but there is some emerging evidence that repeated trauma, so something like in boxing or maybe hockey where there's a lot of contact sports, it may be linked to a greater risk of a condition called chronic traumatic encephalopathy. You don't have to know that, but we just want to be careful with our heads, because it looks like it can cause some problems later on. The last one on this list is infectious diseases. So there are also irreversible forms of dementia caused by infectious diseases like HIV/AIDS, though these are typically more rare. So now we're going to look at those most common types of irreversible dementias, and we're going to start with Alzheimer's disease, and I'm going to hand it over to Chris to get this ball rolling.
Yes, so Alzheimer's disease, it is the most common form of dementia, and it currently accounts for between 60 and 80% of all cases of dementia. Although the onset is gradual, Alzheimer's disease eventually affects all aspects of a person's life, including their mental abilities, their emotions, and their moods. It also affects their behavior and their ability to carry out daily activities like eating and grooming. The disease is named after Dr. Alois Alzheimer, who discovered the disease over 110 years ago. So it's been around for a lot longer than most people think. So what exactly does Alzheimer's disease look like at the beginning? What are things that we can look for, and what are the 10 warning signs of Alzheimer's disease? It might surprise you to know that memory loss might not be the very first sign of Alzheimer's disease. So as I mentioned before, changes in mood, behavior, maybe changes in your judgment might be a sign that happens before memory loss is obvious. So over the next 10 slides, we're going to talk about the 10 warning signs of Alzheimer's disease. But I just want you to note that even though we've numbered these things 1 through 10, they are ordered randomly. So someone experiencing the early signs of dementia might not have each of these symptoms. And although memory loss is common, it might not be the first warning sign for every individual in the early stages of Alzheimer's disease.
All right, so number 1, but like we said, this is not in a numeric order, just to keep track of where we're at, is memory loss. Memory loss that affects day-to-day abilities. And we want to qualify this by saying it's okay, we all forget things sometimes, right? I forget my appointments sometimes, or maybe a colleague's name, a friend's phone number. That's normal. But a person living with dementia or Alzheimer's disease may forget things more often, or may have difficulty recalling information that has recently been learned. They may forget the season or the year, how old they are, what life stage they're in, or maybe they lived at the same address their whole life and now they don't remember which house is theirs.
The second warning sign is difficulty performing familiar tasks. So we are all busy, and busy people can be so distracted from time to time that they might forget to serve part of a meal. And in my family, this happens pretty much every Christmas because my mom really loves to make, it's tradition, she makes this Jell-O salad. And as we know, Jell-O needs to set in the fridge. So what always inevitably ends up happening, it's a running joke in our family, is that the Jell-O salad ends up sitting in the fridge until we're all done our first serving of the meal. And then my mom hops up from the table, runs to the fridge and tries to hawk this Jell-O salad off to everybody when they're having seconds. And we all take some just because we feel bad for her. But that's normal. I think that happens in every family. I hope my family's not just odd, but you typically, might forget to get the buns out of the oven or something like that. However, somebody who's living with dementia might have trouble completing tasks that have been familiar to them all their lives. So maybe they've made the same recipe every Christmas and all of a sudden they're forgetting the steps. Or maybe they're forgetting how to play a game that they've known the rules to forever.
The third sign we're going to look at is problems with language. So I don't know about you, but sometimes my words just kind of jumble together and I end up making half words and words that don't totally fit the context. But I generally know that and I can go back and correct myself. A person living with dementia may forget simple words or may substitute words that don't make sense and don't realize that they're not making sense. So something like, I'm looking for that place with the hot and the cold, and you eat, and they mean the kitchen, right? Not being able to find those words.
The fourth warning sign is disorientation in time and space. So sometimes we forget the day of the week, or we forget our destination for a moment. But somebody living with dementia, they might become lost on their own street, or they may have trouble finding their way home from the grocery store that they've been going to regularly for the past 2 decades. They may find that they're becoming lost in familiar places that they've been to many times.
Impaired judgment. From time to time, we all make questionable decisions, like maybe putting off seeing the doctor when you're not feeling well, or maybe choosing the fashionable outfit over the practical one. However, a person living with dementia may experience changes in judgment and decision-making, like not recognizing a medical problem that needs attention, or wearing really heavy clothing on a hot day, or not enough clothing on a really cold day.
The sixth warning sign is problems with abstract thinking. So from time to time, people might have difficulty performing tasks that require abstract thinking, like maybe using a calculator or trying to get their checkbook balanced or doing their taxes. But somebody living with dementia, they might have difficulties with these tasks because they've lost the understanding of what numbers are and how they're used.
Misplacing things. Well, I don't know about you, but I lose my cell phone almost every day to the point that I've got one of those watches that can ding it so I can find wherever it is in the house at any time. That's normal. We all misplace our keys or a wallet every once in a while. But a person living with dementia may misplace things in places that don't make sense. So maybe an iron in the freezer or a banana in the sock drawer.
The eighth warning sign is change in mood and behavior. So anyone can feel moody from time to time. We all have our moments. But somebody living with dementia, they're going to show varied mood swings. So they're going to be going from calm, maybe to tears, and then to anger for no apparent reason and in fairly rapid succession.
Going along with that last one, changes in personality. So our personalities can change subtly over time, but a person living with dementia may experience more striking personality changes and can become confused, suspicious, or withdrawn. They may also feel a lack of interest or fearful. You might have someone who used to be kind of quiet and withdrawn is suddenly kind of disinhibited and boisterous in a social setting, or maybe someone who always went to church and was very social and involved is now more reserved and closed, not interested in those social activities.
And we made it. We're at the final warning sign that we're going to talk about. So this one is loss of initiative. So completely normal to tire of housework. I mean, we all kind of have to, work up the oomph to want to, clean that bathroom one more time. But somebody that is living with dementia or experiencing the early signs of Alzheimer's disease, they might be passive and disinterested, and they might require cues and prompting to become involved. So this is somebody that maybe was very active in playing euchre every week with their card group, and all of a sudden you're having to, it's like pulling teeth to get them to go. They've just lost all that drive. So the 10 warning signs that we just covered all illustrate the cognitive and behavior changes that occur due to Alzheimer's disease. And over the next few slides, we're going to look at the physiology of the disease and how it actually changes the structure of the brain. All right, so let's take a moment to explore the physical changes that occur in the brain as a result of Alzheimer's disease. Researchers and disease experts have identified and studied two hallmarks of Alzheimer's disease, and we like to refer to them as culprits rather than hallmarks, because culprit seems like a much more appropriate term when you consider the destruction that they cause. The culprits are called amyloid plaques and neurofibrillary tangles, but for simplicity's sake today, we're going to refer to them as plaques and tangles. So let's start with the plaques. Plaques are sticky deposits of a protein called beta amyloid, or A-beta. When A-beta molecules clump together in the brain, they form plaques, which prevent signals from being transferred between nerve cells in the brain, which ultimately causes the cells to die. In other words, these dense, irregularly shaped spots, or plaques of amyloid protein, take up the space where healthy brain cells function and communicate. When they interrupt the signals being transferred between brain cells, the cells die off because they no longer have another cell to activate them. Did that sound a little too technical? Maybe. Let's see if we can build our understanding of how plaques form and impede cell function. So amyloid is a protein that's actually naturally occurring in our brain. And you might be wondering how something that's supposed to be there can become so problematic. Well, In people living with Alzheimer's disease, there's an excess of this sticky protein. And as particles of amyloid float in amongst the healthy brain cells, they come into contact with one another and stick together in clumps. Think about building a snowman. So you start with a small snowball, and as you roll the ball around in packy snow, it gets larger and larger. As more and more clumps of sticky amyloid come together, they form these large plaques, which are like the big snowballs. Plaques interrupt communication between brain cells, and when a cell becomes isolated from its neighbors, the lack of stimulation will cause the cells to die. Then we have our tangles. Tangles are clumps of, or are fiber clumps of a protein, which is called tau. And tau proteins, if you can kind of picture this in your mind, they're like parallel railroad tracks that happen in the brain. And they keep the brain cells alive because nutrients and other important material are transported along those little railroad tracks. In healthy brain areas, tau proteins make sure that the nutrients can reach their destination. But in unhealthy brain areas, the tau protein, it actually collapses and it'll twist on top of itself. And that forms these thread-like tangles, which prevent nutrients from reaching brain cells and result in brain cell death. So the tangles essentially destroy healthy brain cells. As the disease progresses and these plaques and tangles continue to destroy brain cells, the brain itself actually shrinks and affects the function of the brain. The brain can shrink up to 2/3 of its original size and weight over the course of the disease process. So now that we understand what's happening kind of at a microscopic level, we're going to look at the physical changes to the brain caused by Alzheimer's disease. And we're going to start with the image on the left side of the screen. This is an MRI image, and it shows a comparison between a healthy brain on the left and the brain of a person with advanced Alzheimer's disease on the right. You can see the red circle in the red circle, that the dark area is larger in the person with Alzheimer's disease, which indicates that brain tissue has receded. So it's getting smaller, it's depleting. On the right side of the screen is a comparison of the gray matter in a healthy brain on the left and a brain with advanced Alzheimer's disease on the right. Whenever you see spaces and shrinkage, that's a loss of functioning to that particular spot in the brain. This shrinkage directly translates into a change of behavior, function, or ability that the particular part of the brain is responsible for controlling. All right, now we're going to talk about the forms of Alzheimer's disease. So did you know that there was different forms of Alzheimer's disease? Maybe, maybe not. The two main types of Alzheimer's disease are called sporadic and familial Alzheimer's disease. And we're also going to talk about another form of the disease that's called young onset dementia. The most common form of Alzheimer's disease is called sporadic Alzheimer's disease. And it happens as a result of a complex combination of our genes, our environment, and our lifestyle. Sporadic Alzheimer's disease usually doesn't run in families, and it's not considered hereditary. Age is the greatest risk factor for developing sporadic Alzheimer's disease. So most sporadic Alzheimer's disease actually begins after the age of 65. Now we're going to move into the second type, which is familial Alzheimer's disease. And it accounts for less than 5% of all cases. Families with this very rare form of Alzheimer's disease have strong family histories of Alzheimer's disease, where many family members are affected over many generations. Familial Alzheimer's disease is due to changes in specific genes that can be directly passed on from parent to child. If a person has familial Alzheimer's disease, their children will have a 50% chance of inheriting the disease-causing gene and developing Alzheimer's disease. Familial Alzheimer's disease has the same symptoms as sporadic Alzheimer's disease and can develop at any age. terms of young onset. So when symptoms of dementia start before the age of 65, we use the term young onset dementia. Young onset dementia accounts for an estimated 2 to 8% of all dementia cases. While it's rare, there's 16,000 Canadians under the age of 65 who are living with young onset dementia. People living with young onset dementia can be in their 50s, 40s, and even their 30s in some rare cases.
All right, that was our all about Alzheimer's. We're going to shift gears a little bit and talk more about vascular dementia. So vascular dementia is a type of dementia caused by damage to the brain from a lack of blood flow or bleeding in the brain. So you might have heard of your cardiovascular system, right? And that's the blood flow from your heart to all the different parts of your brain. So we're talking about the same thing there. And if you can imagine in your brain, you have all of these neurons, all of these brain cells, and they're to get the nutrients and oxygen they need blood. They need that blood flow. And when there's a stroke, it might be a clot or bleeding, like we just said, and suddenly these brain cells can't get the nutrients they need. So then one doesn't get the nutrients and it dies off. But then this one is connected to so many other cells. So then it doesn't get the nutrients it needs, the communication stops, and this one dies too. And so you get this kind of cascading effect where it affects a whole bunch of brain cells in one particular area. The interesting thing with vascular dementia is that it can occur in any part of the brain. And so because of that, the symptoms can look different depending on which area of the brain is affected. And like I mentioned, it can be due to a stroke, but it can also be due to a cerebral small vessel disease that causes the narrowing of the blood vessels. Similar to like in your heart, if there's a buildup of cholesterol or something and the arteries narrow, the same thing can happen to the blood vessels in your brain. Let's talk a little bit more about these. So subcortical dementia, which we briefly touched on at the beginning, is a small vessel disease, and it causes those blood vessels that are normally, just flowing, all the blood's flowing perfectly to all of your neurons, to become stiff and then twisted. And so the blood can't flow as easily or as nicely to all of your brain cells. It can also damage the nerve fibers that carry the signals around the brain. They call this the white matter. There's another kind of vascular dementia called cerebral amyloid angiopathy. Again, you don't have to be able to pronounce it, don't worry. And this is kind of similar to Alzheimer's disease, like Chris was talking about, where you've got the amyloid accumulating. So in this type, the amyloid accumulates inside the blood vessels and makes it harder for the blood to flow again, and then causes those brain cells to die because of a stroke, or it causes bleeding in the brain as well. What researchers are realizing is that Alzheimer's disease and vascular dementia can sometimes go together. We'll talk about that on a future slide. So what are the symptoms of vascular dementia? We went through these 10 warning signs of Alzheimer's disease. This one isn't as long, I promise you. But here are some common ones. So changes in ability to make decisions, plan, sequence, or organize. Potentially difficulty with movement, maybe a slow gait. So when you're walking, not being able to walk as fast or maybe as evenly on both feet. Poor balance. One kind of hallmark of vascular dementia is this stepwise functioning. So what do they mean by that? Well, it means that the function is fine for a number of whatever it is, days, weeks, months, a period of time, and then maybe there's a stroke or bleeding and there's a decline, kind of a sharp decline in function. And then it kind of evens out again. And you're like, oh, we can deal with this. But then another stroke or a small transient ischemic attack, something happens and there's another step. So That's what they call a stepwise progression, and that we sometimes see in vascular dementia. Now, just because that's kind of characteristic of it doesn't mean that's always how it presents. So vascular dementia can also be slow, it can be gradual, it can be sudden, it can occur in a few different ways. So here we're back at this mixed dementia. So this is something typically when we talk about it, we're talking about Alzheimer's disease mixed with vascular dementia. This is becoming more common. Researchers are just starting to kind of come to that conclusion that more people may have this mixed form. And what's interesting is that this may cause you to have symptoms of just Alzheimer's disease or just vascular dementia, but often it's a combination of the two. And so you might get symptoms of both. Yeah, it's also sometimes you'll hear mixed dementia as like Alzheimer's disease and frontotemporal dementia, or two different kinds of dementia, but kind of the traditional use of mixed dementia is Alzheimer's and vascular.
All right, so our next type of irreversible dementia that we're going to talk about is Lewy body dementia. Lewy body dementia occurs in about 5 to 15% of all cases of dementia. It's a form of dementia that's characterized by abnormal deposits of a protein called alpha-synuclein that form inside a brain's nerve cells. These deposits are called Lewy bodies after the scientist who first described them. The process that leads to the formation of Lewy bodies is unknown at this time, but areas of the brain involved in thinking and movement appear to be the most affected in this type of dementia. So, as I said, doctors don't really know what causes Lewy bodies to form. However, Lewy bodies have a protein that's also seen in Parkinson's disease, which suggests that the conditions might be linked in some way. Lewy bodies typically affect the areas of the brain involved in thinking and movement, and there's two ways in which Lewy body dementia is classified. When cognitive symptoms appear first, indicating that Lewy bodies are present in the part of the brain responsible for thinking, so maybe here at the front, then the term dementia with Lewy bodies is used. If physical symptoms appear first, with cognitive symptoms developing a year or even more later, then the term Parkinson's disease dementia is used. So let's look at some of the symptoms of Lewy body dementia. A person with Lewy body dementia might experience both cognitive and physical symptoms. Cognitively, the person might experience progressive memory loss, problems with language, reasoning, and other higher mental functions like calculation. They might have difficulty sustaining a train of thought. They may have depression and anxiety. They might have trouble with visual spatial disorientation, and they may experience fluctuations in their level of alertness. Visual hallucinations are another common symptoms, and they might become worse during times of increased confusion. For some people, Lewy body dementia might have rapid progression. Memory difficulties may not be a symptom that occurs early on in the disease process, as other symptoms might be more apparent at first, but it can develop as the disease progresses. Physical symptoms include muscle rigidity, or like stiffness of muscles, tremors or shaking. Somebody with Lewy body dementia might have a stooped posture or slow shuffling movements. It's believed that some people diagnosed with Parkinson's disease may also have Lewy body dementia in addition to Parkinson's disease. It doesn't mean, however, that just because you're a person living with Parkinson's disease that you're going to automatically develop Lewy body dementia. It just means that some people living with Parkinson's disease might be at a bit of a greater risk of developing this type of dementia.
All right, we're in the final stretch. This is our last type of dementia that we're going to look at today. So frontotemporal dementia primarily affects the front of the brain. So if you can see this picture on the screen, it's got a person's face facing the side, and you can see it's the front of the brain, that's the frontal lobes, and also this one kind of by the ear, the temporal lobe. And these parts of the brain are responsible for personality, behavior, judgment, even some of our language abilities. And so those are the ones that are most affected in frontotemporal dementia. It typically accounts for about 5 to 10% of all cases of dementia. So it's a little less common than Alzheimer's disease, vascular dementia, and the one that Chris just went over, Lewy body dementia. Thank you. What's different about this one is that it's also its own umbrella term. So if you can think back to that umbrella of dementia, the frontotemporal dementia also covers its own number of disorders as well. So there's ones like Pick's disease, where the brain cells actually get larger, and there's these little silver, almost like a sequins. Anybody who's ever been into fashion or sewing, and you can see that on the screen here. There's all these little silver bodies on this bottom picture. There's also ones where the brain cells shrink and die. So it's not one kind of disease, frontotemporal dementia. Pardon me, it can be caused by many different things. But again, you'll see that personality, behavior, emotion, language, even abstract thinking involved in this type of dementia. Kind of a key characteristic of frontotemporal dementia is that memory is often preserved, and that the first thing you'll notice, kind of the early signs and symptoms with frontotemporal dementia, is a change in behavior, whether that's withdrawal or what we call disinhibition, which would be, maybe saying things that they wouldn't have said in the past, or saying things kind of out of character in a social situation. And or problems with speech and language. Later on, we would see more problems with movement, so maybe decreased facial expressions, not being able to show a full range of emotions on their face, slowness of movement, that rigidity, kind of those stiff muscles that Chris was talking about, and poor coordination. As time goes on, you might see decreased motor skills, so difficulty swallowing. And then in those later stages of frontotemporal dementia, that's when you'd see the confusion, forgetfulness, and things like that. Often in the early stages of the disease, you would just see these behavior changes, and it might look like another kind of disorder. So it's important, if you do notice some of these symptoms, to talk to your healthcare provider about it. So that brings us to the end. Chris, did you want to do a little wrap up?
Yeah, so just in conclusion and overall, we've learned that dementia is a term that describes a set of symptoms which includes trouble with memory, understanding, and judgment, and that there are many different causes of dementia. We only covered a few of them today, but they include reversible and irreversible types. I think now we're gonna open it up. I might, I'm gonna say I would stop sharing my screen, but if I do that, then we should maybe stop the recording.